now bring you a Tampa Bay Times and ABC Action News I-Team special presentation. When seconds count,
Trauma alert.
you have no say in what hospital you go to.
Sometimes they just see you as a dollar sign.
We discovered huge fees the moment patients arrive at some hospitals.
What you have going on now is not best for the patient.
And now, questionable decisions.
He said Justin had been hit by a car.
On what hospitals children in critical condition are being taken to.
I stopped in the grass for a moment and just dropped to the ground.
Which can mean the difference between life and death.
The nearest hospital isn't always the best hospital.
Now, here's ABC Action News I-Team investigator Adam Walser.
Thanks for joining us for a special ABC Action News Now exclusive presentation. I'm I-Team investigator Adam Walser, and with me are Tampa Bay Times reporters Alexandra Zayas and Chris Hundley.
For the past year, the Tampa Bay Times has partnered with ABC Action News, investigating the exploding cost of trauma care and what that means for you and your family.
The Times reviewed more than 10 million patient billing records from Florida's trauma centers.
Discovering outrageous medical fees, why some say costs are out of control, who they blame, and why children may be at risk. We begin our team coverage of what we call insult to injury. It's something you hope
1, 2, 3.
never happens.
Initially, we just knew that he was in an accident.
A life-threatening trauma call.
Pain in your head.
Yet they happen every day.
Trauma alert. 2 blues.
And lives change in a split second.
There was Mason's name coming up on my phone, and I said, "Oh, hi, Mason," and it was a paramedic.
17-year-old Mason Wanaskas was riding in a car that ran off the road in Pasco County. He suffered a concussion when it plowed into an iron gate. Paramedics rushed him to the Bayonet Point Trauma Center. His injuries turned out not to be life-threatening.
The only thing I can remember is just me being in the car.
He did not have broken bones or open injuries or, or unconscious.
But that didn't stop the hospital from charging his family the highest trauma response fee in the state.
Just to walk in the trauma door, they charge us $33,000. That's just to go in the door.
Your cover charge?
Yes.
I can't even begin to tell you what justifies that cost.
The same thing happened to Eric Leonard.
We were going out for my best friend's wife's 50th birthday party. We decided to rent a limousine.
His life changed forever at this intersection.
We have a Lincoln limo versus a possible Jeep.
When the limo driver ran a red light.
I remember the crunch of the metal, and that's really all I could remember.
Leonhard suffered head injuries, multiple cuts, and broken bones. He was rushed by helicopter to the nearest trauma center.
We do have a trauma alert, and one patient's going to be sent down to Longwood.
Longwood Medical Center in Fort Pierce, a level 2 trauma center, billed Leonhard nearly $33,000 the second he arrived. An admission charge officially called a trauma response fee. For more than a decade, trauma centers have been allowed to charge the fee to recoup their cost. But the ABC Action News I-Team, in partnership with the Tampa Bay Times, discovered these fees are being used more often than they should be, are rapidly rising, and one fact is clear. Hospital Corporation of America's trauma centers are charging the highest trauma admission fees ever seen in the state of Florida and driving up trauma cost. The state's 20 non-HCA trauma centers have an average trauma response fee of about $6,000. But HCA trauma centers charge more than $27,000 on average, 4.5 times as much. The 6 highest trauma response fees in Florida are all HCA hospitals.
Sometimes they just see you as a dollar sign.
Records indicate that Leonhard was at Longwood for a matter of a few minutes before doctors determined his injuries were so severe he needed to be transferred to a different trauma center more than 100 miles away. Leonhard, who had no insurance, was billed almost $44,000, $1,000 a minute for his brief stay. He was then flown over 6 other trauma centers in 3 different trauma service areas. Those included 3 level 1 trauma centers, the highest designation in the state.
I coded a couple times coming into Miami.
His final destination was Kendall Regional Medical Center in Miami, another level 2 center owned by HCA. HCA also operates Longwood Regional Medical Center and currently has a preferred partner agreement with the air ambulance company that transported Leonhard.
I think it's more of a business issue than it is an actual saving life issue.
He had no choice in where he was taken. He didn't have the opportunity to kind of shop around.
We contacted HCA about the rising cost of trauma cases. It would not provide an on-camera interview, but in a written statement says in part, quote, HCA trauma centers are providing excellent high-quality care, outperforming trauma centers across Florida with higher survival rates, lower complication rates, and shorter lengths of stay. Equating charges, including trauma activation charges, to the amounts patients pay for medical care is misleading.
What are the trauma fees for? What do you get for that money?
We can handle 2 pediatric traumas at once.
Dr. Mark Voller of St. Joseph's Hospital in Tampa says the fees fund things like specialized equipment, advanced training, and on-call pay.
The trauma activation fee is designed to help you respond within that golden hour for the severely injured patients. So I think that a reasonable fee is certainly justified in those circumstances.
At St. Joseph's, that fee is $1,244, the second lowest in Florida. In recent years, the statewide average trauma fee has grown to $10,000.
What has caught people's attention now is some of the trauma activation fees that are 3 and 4 and 10 and 20 times higher than some of the activation fees that have been traditionally charged.
Pat Balmer of Virginia is a nationally known patient billing advocate.
We're seeing those type of charges nationwide. It's like everybody's on the same gold computer, and all patients throughout the country are getting these kind of charges.
Palmer says those fees are often unjustified.
We're seeing in the investigation we're doing into a number of them that none of the documentation supports the charge for an entire trauma team.
Billing information reviewed by the Times reveals since 2010, at least 7,000 patients who spent less than 24 hours at the hospital were charged the fee.
They have figured out a way to gouge the patient who is brought to them virtually without any knowledge of or any choice.
Connie Potter served for a decade as president of the Trauma Association of America and helped develop trauma activation fees. She believes what's now happening in Florida could unravel years of careful, deliberate planning.
What you have going on now is not best for the patient. There may be a few, glowing examples, but for the most part, it defies all the rules of trauma systems.
Eric Leonhard, who spent 24 days in the hospital, is still recovering.
How much were your bills?
Right now, my bills are probably somewhere a little over the excess of $1 million. And that plays kind of hard on your psyche sometimes.
By the time Mason was released the next day, their bill had grown to $99,000.
It was a shock. It was a shock to see.
In some cases, huge bills like Mason's are being paid by insurance companies. The Times discovered agreements in place between HCA and large insurers to cover a pre-negotiated percentage of those charges.
Insurance companies are paying unprecedented payouts. They're paying HCA hospitals double what they pay everybody else.
You're going to put somebody in an early grave, with the stress.
After the accident, Mason's father, Bruce, a licensed contractor, began taking on additional jobs. But Bayonet Point eventually agreed to settle Mason's bill for $35,000, about a third of the original amount.
I probably could have gotten all 3 of my kids a 2-year degree. When you put it in comparison like that, it's downright scary.
As for Leonhard, the whole situation has shown him how trauma can impact anyone in the blink of an eye.
I didn't do anything wrong to deserve those bills or the situation I'm in, and it's going to affect me for the rest of my life.
After we first reported on the issue of high trauma response fees, HCA announced it would start waiving the fees, but only for uninsured patients.
HCA defends its billing, saying in a statement, what patients pay has more to do with whether they're covered by Medicare or Medicaid, the type of insurance they have, or if they receive an uninsured or charity discount.
But our investigation doesn't end there. The Tampa Bay Times and ABC Action News have now discovered that children with life-threatening injuries could be at risk because of the new HCA trauma centers.
We continue our coverage of insult to injury with this latest development.
I stopped in the grass for a moment and just dropped to the ground.
Sonia Coleman remembers the moment she learned her 9-year-old son Justin had been struck by a car. The star running back of his youth football team laid motionless in the road, unconscious from a fractured skull.
I actually wanted to put my arms around him and pull him close to me to feel his body, but I was scared I was going to hurt or break something.
EMS reports show Justin was not in cardiac arrest or having trouble breathing. Paramedics had to decide to take him to UF Health Shands Pediatric Trauma Center in downtown Jacksonville, which specializes in treating children, or the new HCA Orange Park Level 2 Adult Trauma Center a few miles closer. Experts we spoke with say in most cases, the choice should be clear.
They're not just small adults.
Guy Haskell is a veteran paramedic and EMS instructor who teaches his students that most adult trauma centers don't have the expertise and equipment to treat children.
The nearest hospital isn't always the best hospital. And if it's my kid and my kid is injured, I want him to go to the most appropriate facility where everybody is geared toward children.
But records reviewed by the Tampa Bay Times in partnership with the I-Team show at least 100 Florida children, including 9-year-old Justin, have been taken to Hospital Corporation of America's adult trauma centers. 2/3 had to be transferred somewhere else.
They told me they were going to take him to Orange Park.
Did that strike you as unusual?
It did somewhat.
We drove both routes paramedics could have taken Justin. The camera on the left shows the trip to Shands, on the right to Orange Park.
They could have got right on the expressway versus going all the way through 5 o'clock traffic to Orange Park, which is maybe 7, 8 traffic lights.
Our drive to the Pediatric Trauma Center was actually a few minutes shorter.
There's no question that they should be transported to that pediatric level 1 trauma center.
At Orange Park, doctors determined they couldn't treat Justin's brain injury, so they called a helicopter and transferred him to UF Shands.
It was a terrible feeling.
At that point, you knew this was very serious.
Yes, at that point, I did.
It was 80 minutes after the accident that Justin was finally treated at Shands.
Justin was brain dead at that point.
The delay in Justin's care was an unintended consequence of the recent and controversial expansion of Florida's trauma care system, in which HCA opened 6 new trauma centers in the state. In 2010, there were only 5 cases in Florida in which children were taken to non-HCA adult trauma centers when a pediatric trauma center was within 50 miles. But in 2012, after HCA opened new trauma centers shown in red, that number skyrocketed to 57. Including 11 cases taken to Bayonet Point and 16 to Orange Park.
It is very difficult emotionally to bypass a hospital to go to a farther hospital that may actually be the place that the child needs to go. But it's absolutely essential that that be done.
Last year, the State Board of Health suspended trauma care at Orange Park for deficiencies in emergency care and quality management. HCA wouldn't do an on-camera interview, but in a statement said, quote, "We're not going to second-guess the life-saving decisions first responders make on the spot every day. When young trauma patients are brought into our hospital, the trauma team provides immediate specialized care and then makes appropriate arrangements for their continued care as needed. In every trauma alert, hospitals can redirect patients if they cannot handle the injury."
They said bring them in, even though within minutes of the child's arrival, they had to get on the phone and call the pediatric hospital and ask for a transfer.
The cost can be high, as HCA charges as much as $33,000 to trauma patients just for arriving at the hospital, even if they can't be treated or are transported to another hospital.
The state has no reason, they say, to analyze the data that we're looking at to see what the outcomes are for kids who are taken to adult centers.
There isn't a moment that goes by when Coleman doesn't remember her son. She hopes his death will help convince the state to make sure its pediatric trauma plan is followed.
Who does that? Who plays around with lives like that?
To learn even more about the Times and ABC Action News original investigation into trauma centers, go to tampabay.com/trauma and abcactionnews.com. On behalf of ABC Action News and the Tampa Bay Times, thanks for joining us.
This has been an exclusive presentation of ABC Action News Now and the Tampa Bay Times.